This is More Than Therapy podcast. More than therapy. This is More Than Therapy. More Than Therapy podcast. This is More Than Therapy. More Than Therapy podcast. This is More Than Therapy podcast. And welcome to another episode of the More Than Therapy podcast. Today we have Dr. David Schechter, who's going to talk to us about pain. I work for an MAT, a couple of MAT clinics, that's medication-assisted treatment that deal with pain, chronic pain. I wouldn't have selected this particular venture because it's chronic. It's not something that I can necessarily, or I've been able to, as of late, heal or be able to see progress relating to that. I could try to change their mind regarding pain. I could try to assist them with looking at pain differently, but ultimately they already have their coping skills for pain. They already have their medication for pain, and they seem to stay in that circle or that bubble of what they see as pain management and how they're going to see their lives. I tell people, if you think differently, you behave differently. When I was in the military and I destroyed the left side of my body, I had to think outside of the box in regards to getting better, because if I stayed with the medication my doctor put me on, well, then I know it would have damaged my kidneys. I know it would have damaged my liver. I know I would have became an addict. And if it ever became a point in which they said I can no longer have that medication, I knew I was going to be in trouble. And to be honest, it did come to a point where I did get in trouble. I'm here today with Dr. Schechter, who's going to tell us about his work regarding pain. Doctor.
Great to be here with you.
You too, sir. You too, sir.
I'm a physician that works with a lot of people with chronic pain. Chronic is defined as more than at least 3 to 6 months of pain. And among these people, I find that quite a few of them don't have a clear structural, medical, or biochemical cause for the pain. And so the problem is really the pain is stuck in their nervous system. And that's not to say that it's not real pain. It's totally real. I'm not saying it's imaginary or in the mind. But the power of using your mind and using your brain to break this cycle has been shown again and again in the last 4,000 patients I've treated over the last 25 years using a mind-body psychological and educational program. And so I teach people that their pain is real, but that they can affect it if they're willing to break out of the box. And you had just talked about the fact that a lot of people are stuck in a box. And at these clinics you work at, they're stuck in a box of medication, coping skills. I'm working with people that want to break out of the box. And many of them are not on medication, some of them are, but they have not found success with both conventional and alternative approaches to pain. And they come to me and I examine them and I look at them. And some of them are even on telemedicine now. And if I can determine that they have this diagnosis we call TMS, tension myoneural syndrome. It's also called PPD, psychophysiologic disorder. It's also called neuroplastic pain. These are good diagnoses because these mean that there's a program that can help you break out of your pain and literally get rid of it in many cases or dramatically reduce it in others. And I'd love to talk to you more about the details of the program.
Doctor, would it be okay if I call you Dr. David?
That's fine. Dr. Dave, Dr. David, whatever works for you.
Thank you, sir. Thank you, sir. Dr. David, like I said, I work with many doctors regarding pain management, and they work with me and my company that partners with them in order to, like you know what I'm saying, open your mind to alternatives to just relying on the medication. Work with a therapist who can help you with alternatives. But like I said, I find it difficult to find the alternatives that they will adhere to. Recommendations, please. What has worked in your practice? I know you're unconventional regarding, I don't want to give you hydrocodone or oxycodone. I want to do this. What is this? Can you help us with that?
People have to be open to the idea that what they're getting now is not the ideal. They have to be open to the idea that they want more out of their life than just being on an opiate medication or Suboxone or something like that every day. In your situation, and maybe in some of your listeners, You could start out by looking at a website, like my website, which will be listed in the show notes. You could look at a podcast such as this one and others that I've done. You could look at a book that I've written or that was written by my mentor, Dr. John Sarno. So if the patient is willing to at least get involved, part of getting better is taking action. Part of getting better is empowering the patient, but also the patient taking some of that power rather than just being a passive treatment. So my treatment is very much cooperative. It's very much I'm working with them on that healing journey, kind of like I'm sure you work with as a counselor. I do it as a physician as well. And if the patient just wants to sit in their easy chair and take their pills, you can't fix them. But if there's people listening tonight, and I'm sure there are, who are looking for an alternative, looking how to get rid of their back pain or their pelvic pain or their chronic headaches, and maybe there isn't a really clear structural cause for your problem. Maybe a surgeon has said, there's no surgery that can fix this. Or maybe a surgeon has said there's nothing that we need to fix surgically. It's just pain that we can't really explain. Then what you have to do is you have to start learning. So learning is one of the first steps. Education, if you will, is the penicillin for this condition of chronic pain. Education. You go from education and then you go into psychology. You're going into understanding yourself. Where's your stress and tension coming from? What kind of traumas have you had in the past? We know that childhood traumas are very important. We know that other kinds of ACEs, adverse childhood experiences, are important. We know that other crises, when people are in the military, you get PTSD, obviously women who have been raped. There's a variety of traumas we can have, both large and small, and they can build up and they can lock this pain in the nervous system. And so that's what I help people get out of. And I use a variety of techniques, including, as I said, education. I use journaling. I'm not sure if that's something you use in your work as well, but journaling is systematically writing about your feelings. I even wrote a workbook many years ago. It's still out there, published, the MindBody Workbook, very good, which gives you a structured 30-day program of journaling, of writing about your feelings and understanding yourself better. It's sort of an inexpensive form of psychotherapy because you're doing it in a workbook. You're not meeting with somebody every week. You journal, you learn, and if you're open to this approach, a lot of people get progress just from the writing, just from the expression of their feelings, getting in touch with their feelings. People with chronic pain check in constantly on their pain. They're checking in all throughout, checking in throughout the day. How's my knee feeling? How's my shoulder feeling? How's my back feeling? What I encourage people to do is check in on your feelings. Am I upset? Am I angry? Am I frustrated? And understand your feelings and write about them at least once a day for 10 or 15 minutes. It's very, very therapeutic and very inexpensive.
Earlier, you mentioned tension myoneural syndrome. That's a word I didn't ever hear of that word until I read your bio, and then and then again today. How do you make a diagnosis of TMS?
That's a great question. All right. First of all, I start with a history. I talk to the patient and I understand from the beginning of when their problem started, what was going on in their life. If there was a physical injury initially, I find out what doctors they've seen, what treatments they've had, what imaging results they've had. I take a traditional medical history, but I expand upon that. I ask them about their personality, because it turns out that people with TMS often are very hard on themselves. They're very self-critical. They're often perfectionists. Some of them are goodists, which we define as wanting to change the world, which is a great thing to want, but it's awfully hard to do, and it can lead to a lot of frustration and tension. So we're asking about personality. We're asking about, have they had other stress-related conditions in the past that weren't pain? Maybe they had irritable bowel syndrome, which is like an upset stomach, bloating and stuff like that doesn't have a structural cause. Maybe they've had tension headaches in the past as well, eczema, other things that could be stress-related. I also try to find out about their childhood. So I ask about the childhood and what the family of origin was like. What was it like growing up in that situation that you were in? And how would you feel if another child now went through the situation that you went in as a child? Often that's a way to find out a little bit more about it. So it's a more detailed psychosocial history as well as a medical history. Then if the patient is in my office, which most are, although I'm starting to do more telemedicine as well, if they're in my office, I examine them. I examine the part of the body that hurts, and I do a detailed, if necessary, skeletal, muscular, neurological exam to see that there's nothing wrong, there's nothing damaged. I look for certain tender points on their back, certain areas, certain muscles that seem to tighten up when you have chronic tension. And then I review any imaging that they bring with them, x-rays, MRIs, lab work, whatever, to make sure there's nothing else to worry about. Because it's very important that I can shift the patient from believing that there's something terribly wrong with themselves and that they can never get better, to more of a belief system of it's real pain, but I can overcome it. I can move forward with my life. And many of the patients actually don't have structural damage or anything significant. They may have gray hair of the spine, which is just normal changes that occur as we get older, or they may have other minor conditions. Some of them have an initial injury, but perhaps the pain has persisted far longer than it should have. So that's how I start to make the diagnosis: history, physical exam, imaging, and really kind of putting it all together to call it TMS or PPD. There's other names for it now, but this is what we diagnose it as.
Your book, a #1 seller on Amazon, Think Away Your Pain. What inspired you to write the book? I mean, what was the inspiration to put it in a book, knowing that might take away somewhat from your practice if they had the keys of success?
Well, you want to reach people, you want to communicate your message. Think Away Your Pain is available on Amazon, and that's what it looks like. But my mentor, John Sarno, had written some books in the late 90s. He taught me this approach earlier when I was a medical student. And I felt like I needed to update what he had talked about. He had written a lot of Freudian kind of theory, deep psychology and stuff. And I wanted to get more treatment oriented and more focused on cognitive changes you can make and stuff like that. So Think Away Your Pain is a practical, easy to use, easy to read book that takes you through the steps. Obviously, it doesn't replace a doctor, doesn't replace a therapist, but it's a really good introduction to this. And for many people, amazingly enough, it's all you need. I had my secretary call me today. I was off today, and she said that a patient who had scheduled for next week called up and wanted to thank me. And I said, what was it about? Well, she decided to read my book before coming in to see me, and she said the pain went away. So she doesn't need to see me. So in this case, you're right, it hurt my practice, but it was great to hear from her that she had improved. These are some other things I've written as well. So Think Away Your Pain is the book, and then the MindBody Workbook, which you see one version of there, I think the Kindle version with a slightly different red cover. But the MindBody Workbook is a guided journal. And then I wrote a workbook for teens because I'm trying to prevent this stuff, not just treat it. I want to get it into the school system. I'm off. This is pro bono stuff I'm doing. I'm offering it free to schools that want to be progressive, maybe high schools, and they want to teach their kids about the fact that stress can affect your body, that your emotional health and your physical health are affected by stress. So that's why I wrote that book for the teens. And there's some other things that I've written there you can see as well on my Amazon page. But it can start out by looking at the website. You can start out by reading a book. They're on Kindle. You can download them, very, very cheap. And I think it's informative. Stuff on my website that's completely free that you can listen to, just like this podcast is free tonight. And so you can start to educate yourself and see if you think this applies to you. Are you open to this? Are you open to this? Sometimes people will tell me that they get a gift of this book and they look at it, man, this isn't for me. They put it on their shelf. And then 6 months later, they pick up the book and they go, oh my gosh, I got to read this book. This is exactly what I've got. What has changed in that time? The book hasn't changed. It's the same book. It's the bookshelf hasn't changed. What's changed is that person. And as you know, you have to have readiness for change, right? It's not just the doctor or the counselor or the therapist. It's the patient being ready. It's the person being ready to change. And if you're ready and you're open to the idea of looking at pain in a different way, I think you'll find the program that I have to offer, whether it be an office visit with me, a telemedicine visit with me, or reading one of these books, I think you'll find it very helpful. and see if it's right for you.
When I work with a client, and let's say they first come to the practice from one of the pain medication assisted treatment programs that I'm contracted with or collaborate with, a lot of times they don't even understand that there's another way to deal with pain. They often ask a question similar to this: I don't know why I have to talk to you. And I have to come up with strategies, to, move you away from, reliance on the oxys or the hydros, because the doctor wants you to move you away from that. Or he wants to put you on what he deems safer, which I deem is comparable, Suboxone or Subutex.
Yeah. Well, obviously you're not a doctor, but you know that the doctors are saying to patients more and more, we don't want you to be on these medicines long term. They're bad for your liver. They're actually bad for your hormones. They're not as safe as we thought they were when we started them 10 or 15 years ago, whether it's with you or, the proliferation of the use of the opiates and these MATs and all of that. So we want to get you off of it. So in a sense, the doctor and you are allies in this. And I think the patients also don't want to really be, it's easy to take a pill, but they don't, pain pills don't really eliminate pain. They kind of disconnect you a little bit from pain. They reduce pain. They don't really eliminate pain. And they don't really give you your life back. And what we find with this educational program is there's people who aren't moving. They aren't moving their body. So one of the elements of this, there's a lot of psychological, there's a lot of educational, but one of the elements is just like go out for a walk. Walk 20 feet if that's all you can do. If you have access to a swimming pool, do that. If you have a bicycle or stationary bicycle, do 5 minutes the first day, 3 minutes. And so I really get people moving. And that's something you can also obviously encourage in your counseling work. Get physically moving. It has tremendous positive effects on the body and on the mind to start moving. So simple things you can do: education, helping the patient to change their attitude and belief system, understand what their attitude and belief system is. A lot of people believe I can never get better. I'm doomed to have this pain for the rest of my life. I'm going to be in misery. And you have to just share with them that there's a lot of people who are able to break out of these cycles. Even patients that the doctors don't think will improve can improve. Then you get them to journal, write about their feelings, and then talk to you about those same feelings when you counsel with them or do your counseling. And then get them moving. Get them out of bed, get them out off the sofa, get them off from watching TV, go out for a walk. If they can't go outside, I have some people just walk for 5 minutes around the living room the first day. Second day, 6 minutes. Maybe the third day, 6 minutes. Fourth day, 7 minutes. And I get people sometimes up to walk in an hour in their house. Okay, that's great. Now go outside and do it. I'd rather you start from the beginning outside if it's not too hot or too cold. But movement, very important. So the whole idea is that people have fallen into these false beliefs that pain is stuck in their body permanently, and that medication is the only thing they have, or sometimes surgery, which they've tried, often has failed, is the only thing that can help them. But what they haven't looked is inside, and they haven't realized that the help comes from inside. And someone like yourself and the work that I do and the books and stuff, it's designed to help them and activate their healing mechanism from inside. And that will lead them to not want to be on these meds and to taper off of it much more easily and to get their life back. And that's what they really want, is to get their life back.
In the past, you worked on a project with Donald Dubin, MFCC, who's no longer with us. Can you tell us about that work?
Well, Donald Dubin was a psychotherapist. We created an audio program, and it was turned into one of the books that you have seen there. There's also some YouTube videos that I have as well that are available for free, of course, on YouTube. But Donald was a very insightful psychologist who was the first therapist that I worked with when I started my practice in this chronic pain, mind-body area in the mid-90s. So we're talking about, 25, 27 years ago now. And he was very helpful in his insights. And we started working where sometimes I would refer patients to him. We did some classes. Now I work with new people because he's retired. I do I do a group on Zoom of patients I've diagnosed, and we meet on Zoom on Tuesday evenings, Pacific time, 6 o'clock, and it's a psychologist, myself, and about 8 or 9 patients, and we do a group together. We talk about obstacles to healing, and we talk about skills, and we support each other, and we work to help people solve some of their problems. So working with me, I might refer you to an individual therapist. I might refer you to a group program. There's some interesting apps out there now. There's an app called Menda, MENDA, and it can be downloaded. It's got some great information on this subject. There's an app called Curable that also has great information on this subject. There's an app called Think Up, which has affirmations, positive statements you can say to yourself. And I've contributed affirmations to that app. I'm an advisor to the other 2 apps, although I don't have ownership in them. So I'm giving you objective opinions on that. So these apps are another way you can get started. A lot of people love, just downloading an app on their phone. So Think Up has affirmations, which if you look for the affirmations I wrote, they're all free and you can look at them. If you look at the Curable or the Menda app, you can learn more about how chronic pain is a brain and body disorder. So you can learn that from those apps. And we've talked about books and podcasts. There's lots of great information on this subject, and yet at the same time, it's not that well known in the medical community. It's not that well known, and we've got to get it more well known. It's starting to happen. I'm going on podcasts. I'm talking to people. There's more interest among certainly psychologists. There's some interest among physicians. I'm advising a couple of clinics that want to get started doing this work. So there's more interest than there used to be. We used to be kind of isolated, but I've talked to major hospitals recently about putting group programs in place that would work on this type of an approach. So it's kind of cutting edge stuff. We have scientific research as well. We've had a number of studies published, not by me, by colleagues of mine using this approach that have appeared in major medical journals in the last year. So that's pretty exciting. And, some of those are mentioned in my website or my blogs or my Facebook, that sort of thing. So you can find links to that probably from my website. So things are happening. You've got to decide if you're listening and you're interested, or if you have a family member. Sometimes you might not be dealing with chronic pain. Maybe you're dealing with addiction or other issues, but you have a family member who's dealing with chronic pain. And maybe you want to recommend this website or this book for them to see if they're open to it. I was talking earlier with Chris that a lot of people who end up in addiction for pain medicine, the reason they had addiction was because they had pain, chronic pain, and somebody prescribed them pain meds and didn't realize that they had to understand their pain. And instead of understanding it, and maybe their pain was, a back sprain, but it occurred at a time in their life where a family member died, or it occurred at a time in their life where they lost their job. And so their emotions got wound around that back strain. Instead of going away in 3 weeks like it typically does, it persisted 3 months and 6 months and 9 months. They went to doctors who couldn't find anything, did x-rays and MRIs. Next thing you know, they're on Percocet or something stronger. And so we want to prevent that. We want to treat pain effectively so that people don't get involved with addiction to painkillers that they don't need. Now, there are people who do need painkillers. Certainly, if you have cancer, especially late stage cancer, you want to be comfortable. I'm not in any way saying that painkillers aren't good for that kind of person. But if you want to live a functional life in general, it's better, if you can, not to be on painkillers. It's better not to be on medical assisted treatment or medication treatment. It's better to be using a holistic approach with exercise, education, journaling, counseling, all of this stuff.
You're known across the world as the pain whisperer. Tell me, how do you whisper these mind changing? Because that's what we have to do. We basically have to correct your skewed cognition in order to embrace alternate ways to deal with pain and think about pain. Like you said, we tend to, when we are in pain, we tend to make that the focus of our existence. A lot of clients do anyway. and that this is what's going to fix my pain, or this is what's going to help alleviate my pain. Even with these medications, often I hear clients say, my pain's at a 6, and that's with the medication on board consistently. Why would you be at a 6? Obviously, there's something you're not doing, or something you're not opening, or you're something you're so focused on that is continuously driving that pain. So how do you whisper away the pain?
Well, I start by listening.
Yes.
Okay, because talking is good, it's educational for the patient, but I have to listen. So I ask them the question, and I'm not in a rush. I sit there and I say, I've got the time, tell me your story. And by listening, I can begin to hear the notes between the notes. I think you're a little bit of a musician too, and I know you do photography as well. But the notes between, I'm listening. What's really the story here? What's going on in their life? What went on in their childhood? So by listening here, I can then whisper back to them, oh, I hear that was very difficult for you. That must have been really hard to grow up that way. And that can still affect you now. Or that experience you had 3 years ago, right before the pain started. That could really explain a lot of why this pain is there. Maybe you never fully processed that experience. So you have to listen to be able to reflect back to somebody what they need to hear to begin the process of breaking out of that box that they're stuck in. Starts by listening carefully.
You have a course called the MindBody Healing Journey. Please tell the listening audience about your wonderful course, how they can access it, and what they can hope to get out of such a course, sir.
All right, thank you. So a year and a half ago or so, I was sitting and talking to Dr. Justin Barker, the psychologist that I work with on these online groups. And we said there's almost too much material out there as you start exploring the internet for this tension myoneural syndrome. And so we decided to create a comprehensive but focused online course. And we did it professionally. We had good videography, good sound. We did 5 hours of material. Now, I do not recommend, if you get the course, to watch all 5 hours at one time. I do a half an hour, skip a day, do another half an hour. You can get through the whole course in 10 days that way. 5 hours of material plus PDFs that you can download. And it's a very comprehensive approach, taking you through chronic pain, the mind body, how you diagnose. And the psychologist gives very detailed discussion of the psychological issues and things. And then we come back together at the end and we answer the 62 most common questions that patients have had for the two of us over the last 5 or 10 years about this. So we go into very detailed Q&A, or question and answer. So it's a 5-hour program. It's accessible through my website or on Thinkific directly. And you can go to my website and look for the online course and go to it. And I'm offering listeners tonight, or maybe you're listening to it during the daytime. I'm offering, if you use the coupon code GAMMA, GAMMA 50, there's 50% off the normal price of the course. So that's available for up to 4 people who sign up for the course, the first 4. And I'm offering a code MU35, which is up for 8 people, 35% off the course. There's already an existing discount, I think, of 20% being offered. There you go, Gamma 50. But you can, having listened tonight and to support this podcast, we're offering a 50% coupon. So when it asks you for your credit card, you first must put the coupon code in before you pay for it, so you get the discount. Anyway, it's a 5-hour course, very detailed, very focused, informative, and could be a great way to learn about this stuff. By the way, my book is also on Audible, so if you like to listen rather than read, you can do it that way. If you love video, then the course is video. So it's all videos plus some downloadable PDFs that you can work on as well. So Gamma 50 or MU35 will be the 2 coupon codes, but the first 4 people that get the course can get the 50% discount. And I'd love to hear feedback from people. So after you do the course, you go to my website, you can send me some feedback, and we're getting great feedback in terms of the course in general. So thanks for allowing me to talk about that as well.
Indeed, Dr. David. Please tell the listening and watching audience any final words or any ongoing words to cap us off on this particular episode of the Modern Therapy Podcast, where we're talking about pain?
So we're all dealing with stress every day. And, we all have our good days where we cope and we have our days where we don't cope. But sometimes things build up. Either they build up in your life because of relationships, financial pressures, job stuff, and also builds up from childhood or from teenage years and other traumas you've had in your life. And these psychological experiences can manifest as anxiety or depression. But here's what most doctors don't know. They can also produce physical symptoms that can be identical to a physical symptom from a medical condition. So for example, if you ate bad food, you could get diarrhea from that, right? You could get your stomach, you get the runs. But you can also get the runs from being nervous. Some of you may have had that before participating in an athletic contest or taking a final exam in school when you were in school. So the same endpoint, the same physical symptom can be from psychological or from physical. Similarly, you can get a headache because you've been sitting in a bad position at your computer for 5 hours, or you can get a headache because your significant other has been giving you a hard time, or because your boss has been yelling at you that day. Psychological, physical, both can cause the same thing. What we have found with chronic symptoms, especially chronic pain, is that more of the people with chronic pain, it's coming from the psychological side of the brain rather than from the physical or structural side. It's totally real pain. It's not distinguishable in any way for you. But you can begin to look at yourself and say, you know what, I do find myself worrying about this pain a lot. I worry maybe more than I should. And you might say that you have this type T personality that we talked about before. You're really hard on yourself. You're trying to always fix the world. You're a goodist. You're a perfectionist sometimes. You're a people pleaser. You're very sensitive to how others perceive you. These would be the characteristics of a type T person, T for tension. And so you put together the traumas, you put together the stress, you put together the personality, and you could have a physical symptom like headaches, pelvic pain, back pain, neck pain, that can be fixed with education and psychology. It can be fixed with reading a book or doing a course. It can be fixed with seeing a physician who understands this process. And medication is only going to be a Band-Aid. Physical therapy is not going to fix this, although it might get you more flexible or stronger, because it's not primarily due to physical injury. And by the way, I'm a sports medicine doctor, so if you sprain your knee playing basketball, I'm a big fan of physical therapy. It's just not as effective for chronic pain when the pain is stuck and when the pain is more linked to psychological. And if we wanted to talk more about the research on the brain, there's no doubt that chronic pain, when you scan the brain, is different than acute pain. Chronic pain is linked more to the emotional centers of the brain, and acute pain is linked more to the sensory centers of the brain, which makes sense because it's a sensation. And so just bringing this all together, I want to open your minds to the idea that chronic pain is more complicated than it seems, and yet the answer may be simpler than you think, which is education and processing emotions, becoming aware of stress, dealing with it, and getting the body moving again. So that's kind of my answer for tonight. And perhaps we'll have an ongoing dialogue if you read my book or send me an email through my website. All right? Take care.
Indeed, will do. Thank you for your time. But somebody is in my ear and they wanted me to ask you, what does the name Dirk Chesney mean to you?
I don't think that's a name that I'm familiar with.
They said that they saw you on a television show, and that was your name on that particular episode, a Law and Order episode.
Maybe somebody looks like me, but I'm not an actor. I'm actually a doctor, not an actor, right?
Okay.
That's funny.
I say he does have one of those faces. I think you got him confused with somebody else.
They got me
confused. When I look at him, I think of that MASH doctor. Remember MASH?
Yeah, Alan Alda. I've been told over the years that Alan Alda's a lot older now than I am, of course, right. But it always was. But I mean, when he was younger and I was younger, people would often say you look like Alan Alda.
Okay.
Yeah, MASH guy.
There you go.
But no, I've never been on Law and Order. I mean, if somebody wants to start an acting career, maybe I should consider doing that. But that's not what I do.
Oh, you definitely got the face. You got the voice. Thank you for your time.
Thank you.
And everybody, please go to the mindbodymedicine.com to learn more about managing your pain outside of these Western norms, these norms in which we rely totally on medication and maybe some other interventions. But Dr. David Schechter is going to tell you and help you, assist you with managing pain differently through journaling, through talking. But most importantly, he's going to listen and work with you through the words that you tell him. Thank you, sir, for your time. Be well and be great. And those that are listening or watching on this occasion, if you haven't already, please subscribe to the More Than Therapy podcast on any way which you push play to listen to your favorite podcast. Be well, be great.
I thrive. I thrive to be alive. I want to live a healthier lifestyle. I want to be healthier. I want to be around for my children to graduate, have children, and have their children have children. I want to be free from the disease of high blood pressure and diabetes. I thrive to be alive. I thrive to be